and gentlemen, it is me, Dr. Donna. Welcome to today's personal accountability. Today's topic, worry. What is the first thought that enters into your mind when you hear worry? The definition that I will be using today is this: a state of anxiety or unease, often about potential problems or uncertain outcomes, leading to repetitive thoughts or concerns. It's a state of anxiety or unease, often about potential problems or uncertain outcomes, leading to repetitive thoughts or concerns. So after I looked up the definition, I asked myself, well, what regions are involved in worrying? What brain regions? And so worry involves primarily the amygdala. And so these trigger thoughts of fear, and the response is to alert the prefrontal cortex. And then the prefrontal cortex lands on it and handles it by overthinking and overplanning. And then the anterior cingulate cortex, the ACC, jumps in and says, hey, let me sustain these negative thoughts for you. And that's a doom loop of worry. It just keeps happening. I'm concerned with this. Oh no, what about this? What about this? What about this? Amygdala sends a message to the PFC, and prefrontal cortex says, okay, let me overthink this, let me overplan this, let me just, and then the ACC says, yeah, but, and then on top of that, and then based upon this, and next thing you know, and now you are in this worry doom loop. And as we know, the amygdala's job is just to send notification. Hey, something is happening. But it is the prefrontal cortex responsibility to assess the threat, to assess to see if this is actually factually based, if this is actually happening, what is it that you can do about it from a logical perspective, and then you handle the situation in that moment. And then the ACC sends affirming thoughts. Yes, this is what actually is taking place. This is what we can do for this particular situation, if it in fact is an actual situation. So now that you have this information, the next time you're worrying, really start to assess what is taking place. And then from there, do something about it logically. Now, if you find yourself constantly worrying again and again and again, you need to seek medical attention. You need to talk to your primary care physician to see if there's something else taking place. But overall, if it's something that the prefrontal cortex can handle, then you let the prefrontal cortex assess the worry and then develop strategies and plans and action items for it. And then you let the ACC send affirming, confirming positive thoughts, as opposed to this constant doom loop of worrying. Okay? So next time worry shows up, think about these things that I've said and then implement them. If it's something bigger than that, you think you need to seek medical attention, then by all means, go ahead and do that as well.